All right, hello everybody. Dr. Garrett Wegerif here from Pure Plastic Surgery in Miami, Florida. Thank you for tuning in to another Thursday Thoughts. I'm actually going live from my house today. I was running some errands today. But we are going to be going over myths or misconceptions and facts about breast lift surgery. So if you have any questions related to this, please feel free to shoot them my way and I'll try and get to everybody. So first of all, what is a breast lift? And who's a good candidate for it? So first of all, breast lift helps improve the shape and symmetry of a breast, and it adjusts the nipple position into an aesthetically pleasing, more appropriate position for women who have drooping of the breast, okay? So one of the most common questions we get about breast lift surgery, one of the most common myths about breast lift surgery is that you can do it without any scars or very minimal scars. And that is a pretty big misconception that we have to educate patients on quite a bit. There are a few different types of breast lifts we can do. We can do a peri-areolar for a very select few patients that only need a very minor lift or adjustment of their nipple position. And that's a donut lift where the scar is just around the areola. The most common type of lift we do is what's called a Weiss pattern or keyhole style incision, which involves incisions around the areola, down vertically along the breast, and then along the fold of the breast. So this is the most common type of breast lift that we do, and it really helps us control the excess or loose skin in multiple different planes or dimensions, and it really helps us get a very predictable, pretty beautiful, aesthetically pleasing breast. All right. One of the other common myths or misconceptions about a breast lift is that we can get the same result that you can get from an augmentation with a breast lift alone. This just is not the case for the vast majority of patients. What an implant is able to do is give structure to the upper pole of the breast. So the top part of the breast is where an implant really comes into play. If your goal is just to get your nipple into the proper position and be a little perkier, but still a natural look, you do not need to do an augmentation at the same time. But if your goal is really to get a lot of upper pole fullness and cleavage, then we need to talk about doing a combined procedure, which brings us to our third myth about breast lift surgery is, can it be combined with other surgeries? And yes, it can. It's oftentimes combined with a breast augmentation to help achieve that upper pole fullness. We have one more option for patients that really want to avoid an implant. After we do a breast lift, we can always come back later and do one or multiple rounds of fat grafting to restore some volume to the breast. Again, fat grafting is never going to have the same structure that a breast implant will have, but it can help restore volume for people that have history of breastfeeding or just age-related tissue loss of their breast. So that brings us to our fourth myth. This is only for patients that are older. That is not the case. A lot of younger patients may need this even before breastfeeding, and need is a strong word, but they may desire this to improve the appearance of their breast before breastfeeding. But most women get this done after having children and some breastfeeding, and we're able to tighten everything up at that point. But it's not limited just to women who have had children or have previously breastfed. Anybody with large or drooping breasts can be a candidate for this. That brings us to our fifth myth. Can you breastfeed after getting a breast lift? Yes, the answer is yes. So this is something we always talk about with our patients, no matter what the breast procedure is we're doing. If we're doing an augmentation alone or breast lift alone, you should still be able to breastfeed after having a breast lift. With that being said, there's many women out there who have difficulty breastfeeding that have never had breast surgery. So there's a certain segment of the population that just have difficulty breastfeeding, and it doesn't necessarily mean it's related to the surgery itself. Whenever we do a breast lift, we're leaving the ducts intact to the nipple, and so we're not cutting through any of the ducts. You still have your glandular tissue, so you should still be able to produce milk and feed your children through breastfeeding, but some people just run into some difficulties with that. How do you tell if you're a good candidate for a breast lift or maybe just a better candidate for a breast augmentation. The best thing to do is to have a consultation with the surgeon to really determine what your options are. We can also talk about those different types of breast lifts that might be available to you if you're one of those select patients that might be a candidate for one of the more limited scar options for a breast lift. But one of the big things you can do when you're checking at home is check for where the fold of your breast is. If your nipple is above the fold, you probably don't need a breast lift, and we can get away with just doing a breast augmentation if that's what your goal is, to restore some volume. If your nipple is at the level of your fold or below it, we're talking about some type of breast lift, especially if it's below it. If it's right at the fold, sometimes we can do one of the more limited options to do a donut lift or something like that if we're only lifting a very small amount. But if your nipple is below the fold, we definitely are going to be talking about and thinking about doing a traditional keyhole pattern breast lift. With that being said, patients are always worried about scars, and it's one of these things that just need to educate patients that the vast majority of patients that undergo breast lift surgery, their scars heal very well, and they're happy with their decision to improve the shape of their breast, even though there's a trade-off of those scars. They fade really nicely for the vast majority of patients, and it's just, not a huge concern for them once they go through and do it. So with that being said, I'm going to see if we have any questions here. All right, so I see, how should I prepare for my consultation and surgery if I'm considering a breast lift? So yeah, having some information about whether you're going to need a breast lift or an augmentation is a good thing to think about. The other thing is go in open-minded. Let your surgeon help give you recommendations based off of what your goals are. And that's the second thing you can do to be prepared for your consultation, is have some idea of what you're looking for, potentially bring some wish pictures of what you're looking for. That will help guide us to tell you what we can do, what's realistic outcomes for you to expect, and can really help guide the consultation. What other one? What are the risks or potential complications associated with breast lift? Well, just like any surgery, there's the risk of bleeding, infection. Those aren't very high risk. There's the risk of having some slight asymmetry. We all have some degree of asymmetry from one side to the other, and we do our very best to make that as limited as possible, but it's still possible you may have some slight asymmetries, especially when doing a combined procedure. When we're doing a breast lift with an augmentation, the revision rate is slightly higher when we're doing both of those things at the same time, because there's a lot of moving pieces that we're trying to account for when doing that. With that being said, we do it all the time and we get really good results. How long do the results of a breast lift last? And are they permanent? So in life, nothing is permanent, and it doesn't necessarily mean you'll need to get another breast lift, but you will have some sagging or drooping as time goes on, because gravity stops for no one. So some people, that means they may redo it. If you got it done when you were really young, you're at a little higher risk of needing a revision breast lift later on in life. Or if you're a weight loss patient, these patients tend to be higher risk for revisions in the future, because after your skin's been stretched from weight gain and then weight loss, it just tends to be more prone to drooping a little bit quicker. So who's an ideal candidate for a breast lift? That's what we kind of talked about. It depends on where the nipple position is and related to the fold of your breast. What is a breast lift and how does it differ from a breast augmentation? So a breast augmentation is just what it sounds like. It's augmenting or restoring volume to the breast, but it's not changing the nipple position significantly, and it's not really lifting the breast. That's what the breast lift is for. I think that's all I have for questions right now, but we want to mention we're offering some promotions for the month of August, and they're related to breast procedures. So please go to our website at pureplasticsurgery.com. If you want to have a consultation, there's a link to do that right there as well. You can check out those promotions, and I think the last post we just posted has some more information about the promotions for the month of August related to breast surgery. Thank you all for tuning in, and I look forward to seeing you next week.